Shoot. So we're talking right now today with our new front desk coordinator, Cheyenne.
Hi.
And Liz Baer, acupuncturist, and me, Tori, acupuncturist, about acupuncture at the still point.
So do you know anything about acupuncture?
Very little. I know that it's that it has a huge healing element to it.
Yeah.
But outside of that, not very much.
Okay, so I'll tell you why people typically call and ask about acupuncture. So acupuncture has been shown to help manage pain, to help regulate hormones, to help with stress relief, and all that kind of stuff. So there's lots of different ways that acupuncture can assist the body in healing from whatever it's dealing with. So it could be emotional, it could be something that's really physical. It even has the possibility of helping someone feel better on a spiritual level. Because in Chinese medicine and holistic medicine, none of these things are separate. They're all part of this whole. And with the sort of understanding that everything is a manifestation of the same thing. So I don't know if that's too esoteric, but
No.
we're all manifesting everything at one time. So you can have, let's take for example, you can have back pain, right? And you may have had an injury to your back, but or in your body. So say you were like running and you pulled something. The question is why did your lower back pull as opposed to your hamstrings or something like that? So we can look at it from a very physical aspect, but then we can also ask in to the patient to understand sort of how they interact with the rest of the world, to see if there's some emotional elements to it too that make their lower back a place where there is some vulnerability. So for example, the lower back is associated with the kidneys and the energy that flows through the kidneys. And the kidneys are associated also with the emotion of fear. So if there's someone who's dealing with a lot of fear and sort of interacting with their world from a place of nervousness or anxiety or fear, then that may make their back more susceptible to injury as opposed to a different, like their shoulder or something like that. So we look at the whole picture to try to figure out what's really going on with the person, and we don't break the body up into parts, because we find that that's a Western technique that doesn't necessarily help people achieve real health. So that's one part.
One question that I get a lot. I'm not sure if this is one question, or not question. One thing that I tell people often about acupuncture is that, so when my personal experience, when I went into an acupuncturist like a dozen years ago, I was having symptoms of stress. Okay, it was affecting my digestion, my sleep. I knew that my stress was affecting my body, and I was in my 20s. So I never talked to my acupuncturist ever, though, about other things, other physical things. Okay, I just wrote on my intake form stress, stomach stuff, etc., sleeplessness. But I really had almost anaphylactic reaction to cut grass. Like I was like a mess during grass season. And I never told her about it. We were only working on the stress, but I haven't had a sniffle since.
Oh, wow.
See what I'm saying? So it was like 2 for 1.
Oh, wow.
Do you see what I'm saying? So like you can't stick a needle in someone and not affect the whole body.
Right.
So it's not even like we're going after symptoms, which we can do, okay? But we're not chasing symptoms. We're really balancing someone's whole self. You know what I mean? So things that you might not even say are like an issue become easier or, less prominent.
So one way I can relate that to patients is I use the analogy of like a strand of Christmas lights. So if one of the bulbs has a faulty connection or whatever, the whole strand gets affected. Maybe half of them go out, the other half is on, all that kind of stuff. So it's the same thing in our body. So you can have one little area that's sort of not connecting properly, and it can set off this whole series of symptoms throughout the whole strand of lights, right? And what we do with acupuncture is we use diagnostic detection to figure out where lack of connection is happening, and to try to figure out, do we replace the bulb? Do we just have to make the connection stronger? That kind of thing. And then when you get the right place, or when you figure out what's going on, then the whole thing can light up again, and you have a working strand of Christmas lights. So it's one small thing, insignificant thing can throw a lot of things off, and you may think that the whole strand just needs to be thrown out, when really you just have to kind of have to detect and figure out what's really going on. Yeah.
One question we get a lot of the time is, so will acupuncture work on my fertility or my back pain or my fibromyalgia? Yes. Yeah, the answer is yes. But it's not one treatment, because if it was one $95 treatment, is that what we charge?
90, I think.
One $90 treatment, we would be charging more. You know what I'm saying? We'd be billionaires.
Right.
So one thing that you just get in your mind on how we charge here is, or how we tell people like what they're to expect in terms of their investment is, I always say, and Liz, I don't know if you say something differently, but I say 4 to 6 treatments in a row is what you need to give it. Okay, so we've got, in terms of the services, we've got the intro to acupuncture service. How are you liking that? Are you flipping people? Yeah. So we've got the intro to acupuncture service, which is $55 and 50 minutes. Okay, bargain. Yeah. What I like about it as an acupuncturist is that that's not a big commitment on the person's part. It's a bargain. For $55, you get a real acupuncture treatment. For us, we will talk to the client for a few minutes. We will stick some needles in them on a treatment that will make anybody happy. All right, we're not going to solve all of your issues in this one treatment, of course. And it gives me a chance to really sell them on committing to acupuncture. Okay, and I would say probably more than 50% of the people who come in for that do come back. Then they have to come back for the new client intake. That's $145, right?
But they get a percentage off. They get $30 off of that.
Not anymore.
Oh, okay.
Yeah, they don't get anything off. They have to come back for the new client intake. It's $145. It's an hour and a half usually, and that includes a long health history. We go into much more in depth about what their issues are, what they would like to see resolved. We explain, what they can expect, and then they get a real meaning a whole body treatment. And then there is the follow-up treatment. So that's the first of the 4 to 6. Right. And then after that, I would say 3 to 5, they really need to carve out time in their schedule to come weekly, 3 to 5 treatments in a row. And then we really like to spread them out. You know what I mean? Sometimes people need to keep coming, especially if it's a fertility issue. There may be 2, 3, 4, 5 cycles that we need to see them weekly. But for the most part, personally, I really like to get people to where they're stepping them down. So where I'm giving them lifestyle changes, I'm giving them things throughout the week that they can do so that they are taking their health into their own hands. Absolutely. And they're coming back to see me just to sort of nudge them along the way. Right. So 4 to 6 treatments in a row, then we spread them out every other week, and then about once a month. Yep. And then
keeps them motivated too.
Yeah. And I tell people in Washington, like, this is a once a month acupuncture zone. All right, people should set aside their $90 and come in once a month. Yep. It will be life changing. If that can't happen, or if they're just like as balanced as can be, seasonally. So like right now, between winter and spring, we see a lot of issues and just unhappiness and frustration, exactly. And it's all like kind of seasonally based anyway.
Cool. I'm sure you probably see a lot between fall and winter as well.
Yep.
Yeah. Because they get the winter blues. Yeah.
Mm-hmm. Any questions?
No, this is super awesome. I'm ready.
I think you can also, and just another thing when people call and ask about it, I think you can, health coaching is like a big niche right now, but your acupuncturist is your health coach. I mean, we look at everything. We help you along with your goals. We help you make lifestyle changes. We assess what you're eating. We look at how you're exercising, how you're interacting with the people in your life, all that kind of stuff. And we help you get yourself on the right path. So it is like health coaching, and you also have the benefit of having the needles actually work directly with your chi, which is really important.
That's awesome.
Right. Yeah, that's a big piece of it. We don't just stick needles in and let you go.
Yeah.
Right.
You know what I mean? Because we could stick needles in you let you go, and you could, in 5 minutes, have an interaction with someone or do something that messes it all up. Same thing with medicine. All right, think about it. Why do some narcotics work on some people and not on others? It's like when we're ready to heal and when we're partners in that healing, it all comes together.
Body, yep, it heals. Yeah.
Cool. Yeah. Thank you. This is, I think, great.
Awesome.
All right, so everyone stay tuned for the next Still Point interview. Thank you, too.